Angela Davis was cleaning the hospital corridors on her night shift when she found a doctor collapsed near the operating room. His pulse was weak and his breathing was failing. Angela immediately intervened and saved his life. She was unaware that the doctor she saved was James Morrison, the man who had refused to treat her 6-year-old son Michael 8 years ago when she brought him to the emergency room, saying, "You have no insurance. Go to a private hospital." Angela Davis pushed her cleaning cart through the sterile corridors of Metropolitan General Hospital, beginning another night shift in the medical facility where she had worked for the past 5 years. At 38, she had found stability in this job that allowed her to support herself while honoring the memory of her son Michael, who had passed away 8 years earlier from complications that might have been preventable with proper medical care. The night shift at Metropolitan General was Angela's preference, offering higher pay differential and fewer interruptions from the daytime chaos of busy medical units. She took pride in maintaining the cleanliness standards that supported patient safety and staff efficiency, understanding that her work contributed to the healing environment, even if her contributions often went unnoticed. Angela had completed her certified nursing assistant training years ago, but personal circumstances had prevented her from pursuing full nursing credentials. Her medical knowledge, gained through formal education and years of hospital experience, made her more than just a custodial worker. She was often the first to notice equipment malfunctions or safety hazards that could compromise patient care. The hospital's third floor housed the surgical suites and recovery areas, where the most critical procedures were performed by Metropolitan General's most experienced physicians. Angela's cleaning route included these high-security areas, requiring special access credentials and adherence to strict protocols for maintaining sterile environments. As Angela approached the surgical suite area around 2 a.m., she noticed that the normally busy corridor was unusually quiet. Most elective surgeries were completed during daytime hours, leaving only emergency procedures and critical care monitoring during the overnight shift. The silence was broken only by the hum of ventilation systems and distant monitors from patient rooms. Turning the corner toward the main operating theater complex, Angela discovered a man in surgical scrubs lying motionless on the polished floor near the entrance to OR. Her immediate assessment revealed that he was unconscious, with pale skin and labored breathing that suggested a serious medical emergency. Angela's training kicked in as she knelt beside the collapsed physician, quickly checking his pulse and airway while calling for help through her radio. "This is Angela Davis on floor 3, surgical suite. I have an unconscious doctor near OR3, possible cardiac event. I need immediate medical assistance." The man's pulse was weak and irregular, his breathing shallow and strained. These symptoms, combined with his apparent age and the high-stress nature of surgical work, suggested either a heart attack or stroke. Angela positioned him to maintain airway clearance while monitoring his vital signs until help arrived. Dr. James Morrison's name badge identified him as Chief of Cardiothoracic Surgery, one of Metropolitan General's most senior and respected physicians. Angela recognized the name from hospital newsletters and awards presentations, though she had never interacted with him personally during her 5 years of employment. The medical team arrived within minutes, led by Dr. Sarah Chen from the emergency department. Angela briefed them on her findings and the timeline of discovery while they began advanced life support procedures. Dr. Morrison was quickly transported to the cardiac care unit for emergency intervention. "You did excellent work," Dr. Chen told Angela as they prepared to move Dr. Morrison. "Your quick response and proper positioning probably prevented brain damage that could have resulted from prolonged oxygen deprivation. You may have saved his life." Angela felt gratified that her medical knowledge had enabled her to provide appropriate emergency care, but she was also struck by the irony that she was praised for helping a physician when she had once been unable to secure proper medical attention for her own child during a life-threatening crisis. The memory of that terrible night 8 years ago remained vivid despite Angela's efforts to move beyond the tragedy. 6-year-old Michael had developed severe respiratory distress during a winter evening when his chronic asthma had escalated into a life-threatening attack that his usual medications couldn't control. Angela had rushed Michael to Metropolitan General's emergency department, carrying her unconscious son through the same corridors she now cleaned each night. The child was barely breathing, his lips turning blue from oxygen deprivation, clearly requiring immediate medical intervention to prevent permanent damage or death. The emergency room had been busy that evening, but Michael's condition was obviously critical enough to warrant immediate attention. Angela had expected the medical staff to prioritize her son's care based on the severity of his symptoms rather than administrative considerations about insurance coverage or payment arrangements. Instead, the attending physician had insisted on completing insurance verification and payment authorization before beginning treatment, despite Angela's pleas that Michael was dying and needed help immediately. The doctor had suggested that Angela take her son to a private hospital that might be more flexible about payment arrangements. Dr. James Morrison had been the attending physician that night, though Angela hadn't remembered his name until seeing his identification badge 8 years later. His decision to prioritize administrative procedures over medical urgency had delayed Michael's treatment by crucial minutes that might have made the difference between life and death. By the time Angela had managed to transport Michael to another hospital, his condition had deteriorated beyond the point where intervention could be effective. Michael had died 3 hours later from complications that an experienced emergency physician had said were likely preventable with immediate treatment when symptoms first appeared. The loss of Michael had devastated Angela emotionally and financially, as medical bills from his final hospitalization consumed what little savings she had managed to accumulate as a single mother working multiple jobs. The grief and trauma had taken years to process, leaving her with deep mistrust of medical institutions and their priorities. Angela had eventually found healing through her work at Metropolitan General, where she could contribute to patient care in her own way while honoring Michael's memory through service to others facing medical crises. She had never expected to encounter Dr. Morrison again or to find herself in a position where his life depended on her quick response. The following day, Angela learned that Dr. Morrison was recovering well from what had been diagnosed as a severe heart attack. The cardiac team credited her immediate response with preventing more serious complications that could have resulted from delayed medical intervention. Hospital administration formally recognized her actions in the staff newsletter. Angela felt conflicted about the recognition and praise she received for saving Dr. Morrison's life. Part of her was satisfied that she had proven her medical competence and value to the hospital community, while another part struggled with having helped someone whose decisions had contributed to her son's death. The ethical dilemma was complicated by the fact that Angela's response had been instinctive and professional, based on her medical training and personal values rather than any conscious decision about Dr. Morrison's worthiness for help. She had acted to save a life because that was who she had become, not because she approved of his past decisions. Over the following weeks, as Dr. Morrison recovered and returned to limited duties, Angela occasionally encountered him in the hospital corridors. He showed no recognition of her or awareness that she was the person who had saved his life, treating her with the polite indifference that senior physicians typically showed to custodial staff. The lack of recognition didn't surprise Angela, as she understood that many physicians paid little attention to support staff whose contributions to patient care were less visible than direct medical intervention. But she was struck by the contrast between the praise she had received from nursing staff and Dr. Morrison's apparent obliviousness to their connection. Several months after the incident, Angela learned through hospital gossip that Dr. Morrison had been struggling with personal and professional pressures that may have contributed to his cardiac event. His demanding schedule, combined with recent malpractice litigation and family problems, had apparently created stress levels that affected his health. The humanizing information about Dr. Morrison's struggles didn't excuse his past treatment of Michael, but it helped Angela understand that medical professionals were fallible people whose decision-making could be affected by factors beyond pure clinical judgment. This insight contributed to her ongoing process of healing from Michael's loss. Angela also learned that Metropolitan General had implemented new policies requiring immediate medical stabilization for all emergency patients, regardless of insurance status, with administrative processes handled after treatment began. The changes reflected evolving standards of care that prioritized medical ethics over financial considerations. The policy changes were gratifying because they suggested that other families might not face the same obstacles that had delayed Michael's treatment. Angela's experience had contributed to her advocacy for patient rights and accessible health care, work she conducted quietly through community organizations and hospital committees. 1 year after saving Dr. Morrison's life, Angela was promoted to a supervisory position in the hospital's environmental services department, with responsibilities that included training new staff and coordinating with medical units to ensure optimal cleaning protocols. The advancement recognized her competence and dedication while providing better compensation and career prospects. The promotion also brought Angela into more frequent contact with medical staff, including occasional interactions with Dr. Morrison in his role as department chief. Their conversations remained professional and brief, focused on operational matters rather than personal topics that might reveal their shared history. During one such interaction, Dr. Morrison mentioned that he was grateful to the staff member who had found him during his cardiac emergency, though he still didn't realize that person was Angela. "I never properly thanked whoever discovered me that night," he said during a department meeting. "Their quick response probably saved my life." Angela listened to his comments without revealing her identity, understanding that her satisfaction came from knowing she had acted according to her values rather than from receiving personal recognition. The experience had confirmed that she could provide medical assistance based on professional ethics rather than personal feelings about individual patients. 2 years after the incident, Angela completed her nursing degree through an evening program supported by Metropolitan General's tuition assistance policy. Her promotion to registered nurse represented the achievement of a goal that had been delayed by Michael's death and the years of healing that followed. Dr. Morrison attended Angela's graduation ceremony as part of the hospital's administrative representation, still unaware of their personal connection or her role in saving his life. His presence at the celebration was ironic but not unwelcome, representing Angela's ability to succeed in an environment where he held authority. Angela's nursing career flourished over the following years with specialization in emergency medicine that allowed her to advocate for patients facing critical situations similar to what Michael had experienced. Her work was informed by both professional training and personal understanding of how medical decisions affected families facing life-threatening crises. The experience of saving Dr. Morrison's life had taught Angela important lessons about forgiveness, professional ethics, and personal growth that continued to guide her career and relationships. She had learned that healing from tragedy didn't require forgetting the past, but rather growing beyond it to serve others with compassion and competence. Dr. Morrison never learned that Angela was the person who had saved his life, and Angela never revealed their connection or discussed Michael's case. The secret remained a private testament to Angela's character and her ability to transcend personal grief in service of her professional values and commitment to preserving life. Sometimes the greatest victories over injustice were achieved not through confrontation or revenge, but through becoming the kind of person who could save the life of someone who had failed to save yours and finding peace in the knowledge that you had acted according to principles stronger than personal pain. Angela's story became a quiet inspiration to other hospital staff who learned about her background and her response to Dr. Morrison's emergency. Her example demonstrated that healing from loss could transform personal tragedy into professional mission, and that the highest form of justice was sometimes found in acts of mercy rather than retribution.